Did you know that high blood pressure, often called the silent killer, affects nearly half of adults worldwide? Left unchecked, it can quietly lead to serious complications like blood clots, heart attacks, strokes, kidney damage, and even vision problems. While medications can help manage blood pressure, they often come with long-term side effects and rarely address the underlying causes. But what if you could get to the root of the issue and lower your blood pressure naturally? In this video, we'll explore the real causes of high blood pressure and simple, effective strategies to bring it down naturally. Let's dive in. Understanding blood pressure. Blood pressure is essentially the force of your blood pushing against the walls of your arteries as your heart pumps. Every time your heart beats, it sends oxygen-rich blood through these arteries, which act like highways, delivering essential oxygen and nutrients to every part of your body. Healthy, flexible arteries allow this blood to flow smoothly, maintaining a steady and balanced blood pressure. However, when the arteries become stiff, narrow, or blocked, it takes more effort to push blood through, causing blood pressure to rise. Think of it like a garden hose. When there's a clear pathway, water flows easily. But if there's a kink or build-up in the hose, pressure builds as the water struggles to get through. Similarly, if your arteries become clogged or damaged, your heart has to work harder, and blood pressure increases as a result. Over time, high blood pressure can place extra strain on your heart and other organs, contributing to a range of health risks. This constant pressure can lead to small tears in artery walls, creating weak spots where plaque can accumulate, further narrowing the arteries and compounding the problem. Root causes of high blood pressure. Dehydration. One root cause of high blood pressure that often flies under the radar is dehydration. When your body doesn't have enough water, blood volume decreases, and the kidneys respond by triggering a hormone called angiotensin. Angiotensin narrows your blood vessels, effectively raising blood pressure to compensate for the lower blood volume. This can strain your heart and organs over time. Staying well hydrated with at least 2 liters of mineral water a day helps prevent this. Also, limiting diuretics like caffeine, alcohol, and heavy sweating will help keep your body's fluid levels in balance. Potassium deficiency. Potassium deficiency is another major factor that disrupts blood pressure regulation. Potassium and sodium work together to maintain fluid balance within and outside cells. Without enough potassium, sodium levels tend to rise, leading to fluid retention and higher blood pressure. Unfortunately, most people don't get enough potassium in their diets, often due to low intake of leafy greens and vegetables. Instead of high-sugar sources like bananas, focus on leafy greens, avocados, and other potassium-rich foods to help balance your sodium-potassium ratio and reduce blood pressure. High cortisol levels. High cortisol levels caused by stress and lack of sleep also contribute significantly to high blood pressure. When cortisol is elevated, your body stays in high alert mode, which tightens blood vessels and increases blood pressure. This can be worsened by stimulants like coffee, tea, or energy drinks, which also heighten cortisol levels. To manage stress naturally, try magnesium glycinate, B1, and vitamin D supplements, and calming activities like daily nature walks and herbal teas like lemon balm. Improving sleep quality by prioritizing relaxation before bed will also help keep cortisol levels in check. High-carb diet and processed foods. Next is a high-carb, processed food diet, which is linked to chronic inflammation and arterial damage. Foods high in refined carbs and sugars lead to inflammation in the artery walls, causing small injuries. Over time, these injuries create spots for plaque to build up, narrowing arteries and forcing blood pressure to rise. Switching to a diet of whole, low-carb foods like avocados, fatty fish, olive oil, and other healthy fats helps reduce inflammation and protect arterial health, lowering blood pressure in the long run. Calcium overload from supplements. Another often overlooked contributor is calcium overload, especially from calcium carbonate supplements, which can cause calcium to build up in the arteries, making them stiff and narrow. Rather than supplements, aim to get calcium from vegetables, grass-fed cheeses, and pair these with magnesium and vitamin K2 to ensure calcium goes to your bones, not your arteries. Excess belly fat. Lastly, excess belly fat can lead to high blood pressure by releasing inflammatory chemicals that damage and stiffen arteries. This type of fat around the organs also increases strain on the heart. Intermittent fasting or following a low-carb diet can help burn this visceral fat, reducing inflammation and naturally lowering blood pressure over time. Natural solutions for lowering blood pressure. Boost potassium and magnesium intake. To begin naturally lowering blood pressure, one effective approach is to boost your intake of potassium and magnesium, two essential minerals that help relax blood vessel walls and support heart health. A simple way to get more of these minerals is by including a daily salad with mineral-rich foods. Try a combination of avocado, arugula, tomatoes, cucumber, and even wild-caught salmon to add healthy fats and protein. These foods provide not only potassium and magnesium but also essential nutrients that support balanced blood pressure. Regular exercise. Regular exercise is another powerful way to reduce high blood pressure and strengthen your cardiovascular system. Even low-intensity activities like walking can make a significant difference if done consistently. For a more intense workout, try high-intensity interval training, HIIT, which alternates between bursts of intense exercise and periods of rest. Other great options include swimming, hiking, and cycling, which boost circulation, reduce stress, and help maintain a healthy weight, all key factors in keeping blood pressure in check. Hydration. Staying well hydrated is also critical for blood pressure management. Aim for at least 2 liters of water daily to support kidney function and maintain healthy blood volume. For added benefits, try teas like hibiscus or chamomile, both of which have gentle blood pressure lowering effects. Hibiscus is especially known for relaxing blood vessels, and chamomile can help reduce stress and promote relaxation. Improve sleep quality. Improving sleep quality is another important factor, as restful sleep helps to lower cortisol and balance blood pressure. Consider sleep-friendly supplements like magnesium glycinate, lemon balm, and tryptophan, which promote relaxation and support natural sleep cycles. Reducing stimulants like caffeine close to bedtime can also help improve sleep and overall blood pressure regulation. Diet and sunlight. A healthy diet and regular sunlight exposure are also key. Avoid refined carbs, seed oils, and processed foods, which can lead to inflammation and strain on your arteries. Instead, opt for whole foods that are rich in healthy fats, like extra virgin olive oil, fatty fish, and avocados, which help reduce arterial stiffness. Also, spending 15 to 20 minutes in sunlight each day boosts vitamin D, helping relax arteries and maintain overall heart health. Use quality salt. Using high-quality salt is another simple swap that can make a big difference. Processed table salt often lacks the beneficial minerals found in natural salts like Celtic or Himalayan salt. These mineral-rich salts help maintain electrolyte balance, reducing the risk of dehydration and supporting healthy blood pressure. Prioritize quality protein. Lastly, prioritize quality protein sources, choosing grass-fed beef, wild-caught fish, pastured eggs, and organic chicken. These foods support heart health and help keep cholesterol levels balanced, supporting healthy circulation and reducing the risk of high blood pressure. Herbal teas and supplements. For an extra boost, herbal teas and supplements can be great allies in blood pressure management. To recap, there are numerous natural and effective ways to lower blood pressure by addressing the root causes rather than just the symptoms. Start by focusing on hydration. Drinking enough water daily helps support your blood volume and kidney function. Make sure you're getting plenty of potassium from foods like leafy greens and avocados, which work to balance sodium and reduce strain on your heart. Managing stress is also key. Improving your sleep, reducing stimulants, and adding calming activities like nature walks can help keep cortisol levels in check. Lastly, a low-carb, whole food diet rich in healthy fats, along with daily sunlight, can support heart health and keep your arteries flexible and clear. If you found this video helpful, please type yes in the comments. Your feedback helps us make more content like this. Don't forget to like, share, and subscribe for more health tips every week. Thanks for watching, and remember, small changes lead to big results.